Assalamu alaikum everyone, this is Mubarak Ali Khan. I hope you're enjoying good health. Respected listeners, I'm back with one of OET mocks. With me I have Dr. Karamat, and for next 8 minutes, in 3 minutes he'll prepare, and for the next 5 minutes both of us would try to mimic out a mock of OET. We call that role play situation for you. What exactly will happen? 3 minutes he'll prepare, and for next 5 minutes I'll become his interlocutor, and he would become the candidate as he's professional doctor, so he'll be taking his profession as a doctor. So without wasting any further time, let's head towards this. Sir, it says you're in medical clinic and you are 35 years old. You better know that how to prepare for this.
Thank you.
I'm giving you 3 minutes for that, and you will speak on that for the next 5 minutes.
Thank you.
And the timer has just been started. You still have a minute to prepare. All right. We need to start.
Good afternoon. It's my pleasure to have you. My name is Dr. Ali, and I'm treating doctor for today. May I know what brought you hospital today?
Thank you very much for taking out your time, dear doctor. Actually, I'm 35 years old, and I'm a person who had been eating yogurt and milk or dairy items for longer.
Okay.
And such items did not disturb me ever. But this is the time when I'm getting strong stomach cramps.
Okay.
And which is why I'm worried.
Okay. First of all, sorry to hear about your complaint. Before to proceed towards my diagnosis, first of all, I want to ask about your name. Can you please mention your name?
My name is Mac.
Mac. Okay, Mr. Mac, would you mind if I will ask some further questions so I can clarify my diagnosis?
Yeah, of course.
Okay. When did you first time notice these symptoms?
I guess it's been a matter of last 5-6 days. I had been ignoring it and kept on going with my regular routine.
Okay.
But now, as a matter of fact, it is disturbing.
Okay. Is there any relevant history? I want to ask this. Have you ever been suffering from this sort of disease in your past?
No, there is no history with me as well as with my family. We're kind of person who had been induced with such kind of breakfast since longer, and my father used to have the same one, which is why I take that too. So there is
Okay.
no such history.
Okay. Is there any fever-related history in recent past?
I won't say that. I don't think that, but I had a problem with gastroenteritis.
Okay. One last question. As you mentioned, you got gastroenteritis. When
Yeah.
did you got gastroenteritis?
I believe it's been 2 months.
2 months ago. Okay. Is there any dietary change in your recent schedule?
No, not really. I am just stick to the same things I had been taking since longer. I
Okay.
mentioned dairy items.
Okay. Before I will tell you what my take on it. What you think? What can be the problem?
Well, I'm not pretty sure. I guess you can better tell you're a doctor.
Okay. Well, according to your history, I think you most likely got a condition which is known as lactose intolerance. Have you ever heard about it?
I heard about it, but I think I can be a patient of any other disease than this, since there is no family history like that.
Okay.
And I had been taking things since longer, but now for last 5-6 days, I don't think it can be that sweeping statement like lactose intolerant.
Okay. Just let me tell you the nature of it, and then later on I will come to your concern.
Sure.
Actually, in lactose intolerance, whenever you will eat a diet containing lactose, for example, there is milk or any other lactose containing component in your food, you will start having diarrhea, abdominal cramps, as you were already mentioning.
Yeah.
So, but in case of lactose intolerance, it is not necessary to have a family history along with it. So don't link your family history with it. It can happen. There are several risk factors for lactose intolerance. For example, you can have it after an acute diarrhea,
Okay.
after having some sort of dye. For example, you are going for a CT scan, and for that purpose there is a dye will be injected in your bloodstream. That can cause lactose intolerance. There are several.
About diarrhea, I would admit that yes, I had been exposed to diarrhea.
Yes. Okay. So it's not necessary, as I already mentioned, to have a specific history related to the family. So you should don't think about that. So is there anything else bothering you?
Just let me know how longer will it stay with me? The one you mentioned about lactose intolerance.
Okay. It will take at least for few weeks, but what you have to do during this time is you must minimize those foods which contain lactose.
Okay.
For example, dairy products. You should minimize dairy products.
Can you name 3-4?
For example, yogurts is there, as well as milk is there. So these type of dairy products you should avoid. So if you will minimize lactose intake, your symptoms will get settled. So main problem is there is an enzyme in our intestine which actually involves in digestion or in breakdown of lactose.
Okay.
So in lactose intolerance there is a deficiency of that specific enzyme. So what we have to do is we have to give some time to our gut so it can re-prepare or it can rebuild its pole of that specific enzyme.
Okay.
So just minimize the dairy products and it will settle within few weeks.
Okay. So do we have to take some pills or something for that too, or I just have to ignore?
No, for purpose of diarrhea, you can take ORS, you can maximize your fluid intake, but there is no specific medication for this. So what you have to do is minimize dairy products, and that is the only first line treatment of this disease. So is there anything else you want to know about?
No, I got my idea. Thank you very much for your time.
Thank you. Just want to recall it for you. You got lactose intolerance. That's why you having abdominal cramps and diarrhea, etc. What you have to do is just minimize the dairy products. As well as I would like to see you after 2 weeks just to follow up your status. So is there anything else?
No, I'm done with it.
Hope you got your answers related to your each and every concern. I really enjoyed your presence.
Thank you very much for your time.
Thank you so much.
Thank you.